हाँ, तो हम देखेंगे क्लिनिकल फीचर ऑफ infective endocarditis. Specific feature of this infective endocarditis is worsened regurgitation, means if regurgitation present previously, then after infective endocarditis, its condition get worsened. Other non-specific clinical feature is fever, chill, myalgia and arthralgia, osseous node and subungual hemorrhage, Janus lesion, neurologic manifestation, splenomegaly and clubbing, petechial hemorrhage. Lab diagnosis can be done by through blood culture, in which at least two sets on the at the interval of more than 12 hours as collected and cultured. Otherwise, second uh, second method can be more than three sample can be collected with 1 hour, at least 30 minutes between first and second and third sample collection. Then can be then second method is serology. Third is direct fluorescence antibody detection. Otherwise, we can use PCR. And one other method is clinical diagnosis of through electrocardiography. Diagnostic criteria of infective endocarditis is modified Duke criteria, in which there are two criteria, major criteria and minor criteria. Major criteria have two parts. Positive blood culture, either typical infective endocarditis organism from two separate blood culture set, or persistent positive blood culture without other than typical infective endocarditis organism. Like in this typical infective endocarditis, infective endocarditis organism have Staphylococcus aureus and has group organism. Other organism which is not typical, if blood culture is constantly found positive, then it can be a criteria for diagnosis of infective endocarditis. Second criteria is evidence of endocardial involvement. Endocardial involvement can be assessed by positive endocardial finding like oscillating intracardiac mass on valve or abscess. And the third, new partial or dehiscence of prostatic valve. New valvular regurgitation can be seen, although minor criteria contain predisposing factor like mitral regurgitation, IV drug user, and other is fever. Second criteria is fever more than 38 degrees centigrade or 104 Fahrenheit. Vascular phenomena can be seen like arterial emboli, pulmonary infarct, myopathic aneurysm or intracranial hemorrhage. Conjunctival hemorrhage, also called as Janus lesion, can also be seen in a vascular involvement. Immunological phenomena can be either in the form of osseous node or Roth's spot. Microorganisms evident other than this positive blood culture test, like any other organism which generally abnormally found in blood culture. Treatment part, in treatment, if in normal or natural wall condition, if blood culture is sensitive, methicillin sensitive Staphylococcus aureus is found, then cloxacycline or nefacillin can be used for 6 weeks. Or if methicillin resistant Staphylococcus aureus is found, then vancomycin antibiotic can be used for 6 weeks. If it is prosthetic valve, if it is a prosthetic valve, then if methicillin sensitive Staphylococcus aureus is found, then along with cloxacillin or nefacillin, add gentamicin for 2 weeks and rifampin for 6 weeks. In case of HASC group, ceftriaxone or ciprofloxacin can be used as a treatment of choice. Thank you for watching.